So sometimes you might need to start seeing the clinical signs to get a positive test result. So if you want to test for an acute infection that's very active, the pairs are starting to showing clinical signs, you should choose a correct diagnostic procedure. Now is the time to find either the virus or find part of the virus. So you either do virus isolation or do a faster test, which is PCR. PCR will detect the nucleic acid of the virus. And for those samples, you don't take blood, you take what we call oropharyngeal swabs. So it's a swab material that you put it in the mouth of the bird, try to get to the larynx or to the what we call a cranial cleft, which is a slit at the roof of the mouth. So you get some respiratory secretions, and those respiratory secretions, you look for the virus for it. However, if you are kind of late reporting to the diagnostic lab and you want to test for it maybe 2 weeks after the clinical signs started or faded, then if you do the PCR, the virus might be gone by now. You need to use a different test. So you use a serological test like ELISA, which you detect antibodies against Newcastle disease. And there are other testing procedures like hemagglutination inhibition, especially for Newcastle, and some other tests like for other disease like influenza.